Uh, Everyone's back here now. I would just like to share some fantastic stuff with you before I let the next speaker up on the stage. Uh, she is a very young speaker, the youngest one we have. Sorry for saying that now. Young and brilliant, rising star. And the fantastic thing is that as soon as she does anything on LinkedIn, LinkedIn just takes off. It's like skyrockets. And Mrs. Pooja Ganatra is from Dubai, and some of the magazines there actually found out that she was going to come here and present. So they made a big article on that, saying like the female young person going to Sweden to represent, blah, blah, blah. And as of this weekend, it has 100,000 views, right? Respect, right? Right. So I welcome Pooja up on the stage. You are an engineer working with acoustics and sustainability from Bureau Happold in Dubai. So please
Thank you.
show us
Thank
all.
you, Maria.
Thank you.
Hello, everyone. Hope you had a good break. So here we are talking about leading the way in hospital acoustics. Just something about me before we get in there. As Maria mentioned, I am working at Bureau Happold as a sustainability consultant, and before that, I was a purely acoustic consultant with WSP. My background is architectural engineering, and then I decided to specialize in acoustics. Yes, I do look young, but I have 5 years of experience because I was working and studying throughout my university life. And I am a graduate from Heriot-Watt University and a part of the Institute of Acoustics as well, where I did my postgraduate diploma from. So before we dive into just the objectives and what we're going to talk about in terms of lead and hospital acoustics, I want to get a bit more personal and talk to you about where I'm from. So I'm from Mumbai, India, and my parents are doctors, right? So I was born in an atmosphere where post-school, come home, you're not going home. You're going to the hospital because that's where my parents are and there's no one home. So I was kind of brought up in a hospital environment, essentially, and working in a cabin next to my parents where they're like, okay, do your math homework while we're working, and pretty much surrounded by this entire chaos or sort of people around there, right? So to me, this topic is really something that takes me back to where I really came from, and also look forward to how we can enhance acoustics in healthcare. And that has to be looked into further as well. So just a quick table of content where we're looking at these 5 major things. Let's get into the context. So healthcare facilities, which are highly sensitive spaces, right? It is essential that we ensure occupants are comfortable at all times. And just based on some literature review that I carried out, the team Hart in USA said that 66% of healthcare workers found their surroundings to be noisy, 86% of patients found it noisy in their rooms, and 30% of workers thought wearing masks was hindering their communication, which is also a topic that we will touch on in terms of how mask attenuates your speech and causes speech intelligibility issues in these kind of facilities as well. Furthermore, many articles and research papers have published the effects of noise in hospitals. As you can see, there's Harvard Medicine, there's Science Direct, and Noise Health as well, who've published a lot of these articles around noisy healthcare environments, right? However, it is essential that we provide a holistic approach and look at elevating the healing environments in hospitals with LEED Platinum, or LEED certification in general, right? Now, what is LEED? LEED is essentially, obviously, looking at an encompassing sustainability aspect, where we look at sites, water, energy, material resources, indoor environment quality, and innovation and design. And it is set to increase productivity. It's set to give you fresher air because you're looking at a lot of different aspects within a space to make it more healthy holistically, right? Now, yes, there is LEED, yes, there is acoustics, but we know that it's not mandatory for us to have an acoustic credit when we're going for LEED certification. It's something that it's very optional, which personally I don't think is acceptable, right? I mean, it's, especially if you're looking at healthcare facilities, it should be made mandatory to ensure that acoustics is a mandatory credit to achieve. However, in education, I believe, you still have to meet one of the points within LEED. But healthcare, they have no signs of, yes, we need to achieve this. So that's something that was lacking within that. and the lead V4 credit EQ, C9. Basically, EQ is the environmental quality aspect of things, and they have these pointers within the acoustic aspect in terms of HVAC, noise control, room acoustic, STCs, sound isolation, acoustic modeling and testing, and the level of certification that you would achieve. So my study was basically conducted at this hospital in India, which we will dive into further. But this is really the framework that we will follow. And at the top there is this little framework piece that you can follow throughout this deck as well, where we first understand the acoustics of the hospital, then we collect the data, we analyze it, and then we draw conclusions to how the lead acoustic, the lead hospital essentially, versus the hospital without any certification or any acoustic treatment, and how doctors found it and how the results were also quite varied. So the acoustic comparison between Criticare Asia, Juhu, Mumbai, which was non-certified, and the other one is also a Criticare hospital. Both, my parents worked there, so it was quite easy to get access to these places as well, which is LEED Platinum certified, and the only LEED Platinum certified hospital in the entire of Asia. So it was quite a pleasure to work with this hospital as well. Now, as you can see, the design itself, right? You can tell this one is complete. The one without any certification is completely glazed. They have mullions and a steel facade. However, the one which is LEED Platinum certified had a double pane laminated glazing, which are higher performance, and also ACC block thickness of the entire facade, which makes it already shielded from the environmental noise. And being a noisy city, this was essential in terms of kind of safeguarding that entire space. They also followed LEED, and they also had another standard that they follow in terms of acoustics in healthcare environments, which is an Asian standard, which they usually follow in India. We now look at how we've collected the data and how we've understood the hospital conditions, right? So there are a lot of doctors working in there. So the first hospital, which was the non-certified, had about 125 doctors coming in there, and the other one had about 185, I think. And that was a lot of doctors, and there's no way I would send out surveys, get responses, so it was more about just calling them up or asking my parents to kind of get me in touch with them and ask them a few questions and then kind of devise my entire understanding around it. So as we can tell, we saw that the reception areas, which is the non-certified area, essentially this part, was quite high in terms of the dBA levels, 51, with the RT to be around 2.21. And as you can see, it was quite a low area with acoustic ceiling as well, with perforated tiles at the top. So it performed pretty well. However, the reception area in the certified area was a double height with acoustic treatment at the top, but it was a double height space with a much higher reverberation. It's not as much, it doesn't look as much higher than the non-certified, like it's within the 2.2, 2.6 range, but it was considerably, you could make a difference out of it when you enter the space. And then for the patient rooms in the certified areas, it was much lower, as you can tell, which was, here, for unoccupied. Sorry, I think that's switched up. But it's basically the certified area was much lesser than the non-certified area as well. Now, generally, LEED certified hospital is shown to have better internal acoustic treatments. The one which is LEED certified has a really good location as well. So it's not next to a very highly traffic dense area. It's next to a school. So already the area is kind of calmer in terms of their noise around it. And they also had suspended ceiling tiles in corridors and tile carpet flooring within the hospital rooms itself. And for the non-certified hospital, they had an acoustic ceiling within when you enter the space, so that made a difference. And they had just thick curtains around that, which didn't really help because this is right in the middle of a junction where there are cars 24/7. So it's really, really noisy. So from the outdoors, there was noise coming through. The walls between the two rooms weren't as well designed either. So it was quite disastrous in that sense, but it's a hospital that's always working and buzzing all the time, and that's how it is in terms of the population there, so it had to carry on and move forward. Now, this is a past research that I had conducted in terms of masks and sound attenuation, where I had done a understanding of how surgical masks affect speech intelligibility. And surgical masks are something that have been constantly used in the healthcare facilities. We can tell that they do give you a sound attenuation of 4 dBA, which is also considerable, considering that you walk in a space in Mumbai, in the heart of the town, super busy, super noisy, and then all the doctors are wearing masks, and then you're trying to communicate with them, trying to understand things, and it's really something that's not feasible if you don't look into acoustic standards, if you don't look into understanding what sustainability aspects you need to look into in terms of lead, etc., to make it a bit more, livable, or a place that you would want to go to if you have to, in terms of meeting your loved ones if they're in a hospital, or like me, just going there to study sometimes. Now, as we spoke about how I spoke to doctors and kind of understood their perception, and in the non-lead hospital versus the lead hospitals, we saw that 75% of the participants mentioned that they had to raise their voice very often in these spaces, because obviously it's noisy around there. 64% found the atmosphere to be more welcoming. I think that was more because it was the double height ceiling reception and much quieter due to the location as well. And in the lead hospital, it was 65% had to raise their voice very often. So it's much lesser, I mean 10% lesser, but they still had to, because it's noisy, people are coming in all the time, there's so many people at all times, it's always busy. So it wasn't a drastic difference. And what was interesting was exactly 40% of the participants found it difficult to understand the person due to low speech clarity in both hospitals. So that means it's just an issue in terms of maybe the masks, maybe just how the spaces weren't as designed as per standard to achieve even the LEED certification, where they say that it should be within 0.6 to 0.8 seconds RT within these patient rooms, which was not achieved either, right? So yes, they achieved the LEED certification, but they missed out on that one part within acoustic because it wasn't mandatory, right? And then further to that, this was another study that was carried out in terms of no mask, surgical mask, and N95 plus face shield in terms of their speech perception within generic spaces. This is not particularly for healthcare, but in terms of their perception as well, on a speech perception scale, you have a muffle of speech using those surgical masks, which are quite often used in these healthcare facilities. However, if you have an N95 with a face shield, which was the case during COVID, and hopefully there's no other pandemic in the future, but if there is by any chance, it's going back to like literally a 3 out of a 7 on the perception scale, which really makes it lower and lower. And being in a city which is developing and already doesn't look into these aspects, it is quite crucial and essential to look into achieving sustainability statuses and rankings, right? Now, just around conclusions, recommendations, so we bring back the chart there and we speak about how we understood the hospital conditions. We surveyed the hospitals. It was found that the LEED certified had better acoustics. Carried out an assessment of the build-up. The LEED Platinum again had a better acoustics because in terms of just the overall layout that we saw, lower glazing, better ACC block work around the facade. And when we spoke to the doctors, they also said that it was just more welcoming. Like whenever I had a chat with them, the first thing that they said was the massive ceiling just made it more welcoming, and rather coming to a space which had just very low ceilings and you walk into it and it wasn't as good. In terms of an analyzed data, we see that LEED certified room use double glazed windows, 100 thicker walls, and have acoustic panels in the rooms that we saw in the images. And the reverberation time is about 0.2 seconds lower in the patient rooms, which again isn't the best, but we go back to the whole LEED conversation. And doctors who work in the LEED certified hospitals are 56% more satisfied, which, yes, because it's the overarching understanding of sustainable sites, energy efficiency, indoor environmental quality, including light, including thermal comfort. So all of those things make them want to be at the hospital more. It's not just acoustics here, right? And we drew conclusions and looked at further opportunities in terms of, yes, it was carried out in person, but also a lot remotely on my end, where I was on calls with the doctors, and it should be under more laboratory controlled conditions in terms of there were sometimes people walking around the corridors when we were making the measurements, and you couldn't control that, right? It is busy, and there ought to be some noise coming in through. And further studies, we can examine the speech perception with aging-related hearing loss and engagement with patients as well, because that would be a different perception altogether, to more like the ones that come for general practicing rather than major illnesses, because I don't think they would be willing to answer questions there. But yeah, that's me. Thank you very much for listening, and thank you.